Hello, ladies and gentlemen. An indicator of healthy skin is a non-compromised epidermal barrier protecting against external factors and different pathogens as well. The knowledge of structure and physiological processes within the skin is useful for the implementation of preventive actions whose aim is to restore and protect the barrier function and can also help initiate effective treatment. Although no treatment can entirely reverse the effects of aging, there are numerous options for reducing various age-related problems and skin changes. Some of these therapies carry risk of side effects, well, of course, and most require multiple treatments to achieve and maintain results. This underscores the need to incorporate proper daily skin care that may assist the stratum corneum in maintaining epidermal barrier integrity. I should say that a basic skincare regimen should include a gentle cleanser, toner, moisturizer, and, of course, without any doubt, sunscreen. They should typically be applied in that order, all right? So, as for the professional, it is our responsibility and my personal responsibility to recommend the most suitable skincare products for the client to purchase and use, as well as the best and efficient treatment modalities. Wow. Nowadays, patients can be, and I always say this, that should be fully informed about the finest skincare therapy adapted to them. Therefore, they will be happy, they will be able to follow more effectively to all the positive effects given by the individual therapy. All right? So, specific therapies for individual concerns may be added to the basic routine as needed. Well, for example, age spot cream or eye cream may additionally be applied depending on the client's needs. The serum could be added to the skincare regimen as an additional moisturizing agent as well. Some exfoliation solutions, let's say scrubs, could be used once a week, especially if the patient has the oily skin type. In addition, a weekly intensive treatment, such as cleansing, purifying, or intensively hydrating mask, may be quite beneficial for some of the clients. But there are a few things that you must do for your skincare routine. And it doesn't matter if you are young or old, female or male. You have to do all these things to have healthy looking skin. By the way, how does healthy skin look like? Healthy and young skin is first, even colored. Second, smooth and firm. Then, it is free of pathological lesions. Later, we know that it's free of wrinkles, and it also has no damage, has no sun damage. And the most essential steps of the skin regimen that I've narrowed it down are, one more time, cleansing, toning, moisturizing, and sunscreen protection. So, shall we start straight away with cleansing? I'm going to tell you a few words about it. You have to ask yourself first whether your skin is oily, dry, normal, or combination, and choose the cleanser accordingly. So, what are the skin cleansers? Skin cleansers are surface active solutions that lower the surface tension of the skin and remove sebum, different pathogens, microorganisms, and exfoliated cells. There are 100 types of cleansers on the market. Cleanser foam, cleansing milk, cleansing gel, cleanser lotion. We have so many of them. That is why we have to first to determine what type of cleanser your client need, depending, the client need, right? Depending on what skin type the client, the patient has. So one of the most important criteria for choosing the cleanser is the pH level. Those with pH of about 5.5 are relevant. The ideal cleanser should clean the skin without irritating, damaging, or disrupting the skin barrier. Water alone successfully removes the high percentage of oil and dirt from the skin surface, but is less effective at removing of cosmetics and some environmental insults. And if you have dehydrated skin, I will avoid using foam cleanser because it would dry out the skin even more. And if the client has oily skin, I will avoid using milk cleansers because it is too moisturizing and you wouldn't feel cleansed after. In general, liquid facial cleansers are much gentler, effecting less disruption of the barrier, and usually contain a combination of surfactants classes, moisturizes and acidic pH to do not compromise the skin barrier, all right? So you really have to find a good and gentle cleanser that best matches the skin, and the approach is very individual in every single case. So what is next? Next step is toning. Let's say a few words about toning and what it does. It brings the pH of our skin to the normal level and helps stratum corneum, the horny layer of our skin, to maintain its normal physiological functions. That's what all the toners do. It is their function. And I just want to remind you one more time that pH balance is nothing more than a balance between alkalinity and acidity of our skin. The pH level may range from 1 to 14, and if the pH is equal to 7, it means that pH is neutral, and if it's higher than 7, it is alkaline pH. In case of it is lower than 7, it is acidic. So normal pH of adult skin is in the range from 5.4 to 5.9, and average is 5.5. So internal and external influences determine the acidity of the skin. And what the most important things for it? The most important anatomic side, because different anatomic side may different pH, age, the use of cosmetic products, skin irritants and detergents, so the soaps and synthetic detergents may change the pH of the skin, and occlusion by body folds or dressings, the use of different topical pharmacological substances, and even simple contact with water may change the pH of the skin. So, and having a healthy pH level and skin balance means that your skin is able to protect itself and have a strong skin barrier. This means if the balance is broken, it will change the ingredients of the skin barrier, the lipids. It may cause inflammation and manifestations of different skin disorders. When the pH starts to go lower, the skin becomes more acidic. This means that the skin is going to increase the production of sebum, making the skin feel oily and greasy. When the skin is more acidic, the skin becomes more rough. We call it the keratinization, becomes dry. So keratinization process doesn't go properly and make your skin feel really rough and lose its elasticity. On the other hand, if your skin gets more alkaline, then it starts to decrease the production of oil and sebum for your skin. What does it mean? This means that your skin will start to be more sensitive and dry. That is why, in order to maintain the skin in a healthy condition, you need to make sure that you are not way too acidic or way too alkaline. Nowadays, toners are even more efficient. So they are not just balancing a pH, but some of them may also remove the makeup and cleanser residue. What they also do? They also prepare our skin for moisturizing to go on later. So, and now it's the time to say a few words on moisturizing. So, moisturizers are formulations designed to maintain the water content of our skin. And the most popular, lotions and creams are the most popular moisturizers for consumers, all right? Because everyone heard about it. And these are emulsions of oil and water-soluble ingredients. The compounds in moisturizers that cause hydration of skin are, we call them either humectants or emollients. And emollients are lipid-based ingredients that form a barrier on the surface of the skin to trap moisture in the skin and to prevent the water evaporation. And basically, they work as a barrier. So examples are butters, oils, esters, and but what should I say? The emollients shouldn't be used in your everyday skincare routine because of their mechanism of work. So emollients have occlusive properties which will reduce normal evaporation of water, which is a normal process. That may slow down the restoration of the barrier function of the epidermis. It can disrupt the synthesis of epidermal lipids. So most widely, emollients are used in the dermatological practice, in the treatment of dermatological diseases. So humectants are ingredients that attract moisture into the stratum corneum. This is very natural, so and is resulting, most of them are very natural, not all of them, okay? So resulting in an increased hydration of the skin. I'm going to mention those natural humectants. So, and examples of humectant ingredients in cosmetics are glycerin and natural ones like components of natural moisturizing factor. It's something that is on our skin that can bring the water. So ceramides are also good. Squalene, cholesterol, fatty acids. So and proper and rational moisturizers are designed to mimic the function of epidermal lipids in the skin barrier. Due to the hygroscopic properties of this this mixture that I've just mentioned, water can retain the water within the stratum corneum even under very extreme conditions. Thus, when choosing the moisturizer, you have to look at the list of ingredients first. That's what you have to do first. And then select the one containing those natural compounds that I've just told you, that I've just mentioned, such as ceramides, one more time, all right? Compounds of natural moisturizing factor. There are plenty of them. You may Google it and to find out what are the ingredients, what are the compounds of natural moisturizing factor. But always bear in mind that some of the people may have possible individual sensitivity to the mentioned components. And well, it basically goes to toners, and you can be just sensitive to all of them. So you have to try it first. And last but not the least is protection. And the following question is why? Just because without this step, the whole basic skincare routine is impossible. After all, I want to remind you that the photoaging is another one cause of extrinsic skin aging. UVB and UVA are the bad guys, all right? So no matter what skincare routine you have, no matter where you stay, the one ingredient which is the best for anti-aging is the sunscreen, right? 100%. So, and sunscreen is the essential anti-aging product you may use, not only because it may decrease the risk of different skin disorders and disease, even like a skin cancer, but it also improves the way how people look over time. So, the people have to protect themselves against the sun damage. It is very, very important. It is critical. So you could never go wrong by using a moisturizer containing SPF every day, every morning, 7 days a week, 365 days a year. Because with no doubt, sunscreen is a golden standard for skin protection. It's a must to wear sun protection cream with SPF at least 30, yeah, especially in the southern countries or in summer. And yeah, please make sure you apply enough of it, at least 30 minutes before you go, before going outside. I wouldn't recommend use and apply anything more than SPF 50 because it is very rich and oily and it can cause problems and you can clog up your pores of your face. So finally, I want to say that the people shouldn't forget a few simple actions of their skin regimen. First, you have to clean your skin, use a cleanser, then tone, then moisturize and protect. All right? Thank you very much for your kind attention and see you next time.